Hi, everyone. My name is Yunche Wilson, a guest correspondent for MedEdge MEA at the Bone Marrow Transplantation and Gene Therapy Congress here in Abu Dhabi. I have here with me Dr. Rasmi Palassery, who is an expert in bone marrow transplantation. Hi, how are you?
Hi, good. How are you?
Can you tell us where you work out of currently?
Yeah. Right now I work as an associate professor in the Department of Medical Oncology, Hematology, and Bone Marrow Transplant in a medical school called Ramaiah
Okay.
in Bangalore, in India.
Wonderful, wonderful. So we have a set of questions here for you today, and we just want to go right through them. Um, First question being, what kind of infections can children get after a bone marrow transplantation?
So, infection is basically a situation that arises when a germ, it can be a bacteria, a virus, or a fungus, enters your body and causes inflammation and starts affecting the functioning of various organs. So, in bone marrow transplant, because of the fact that your immune system has just been replaced, you're on medicines to suppress your immune system, you are prone to developing a lot of different infections. They can start from affecting one particular part of the body to having infections that are there in your entire bloodstream. We call it as bacteremia. It can be infections of the brain, sinuses, oral cavity, the gut, starting from the esophagus, intestines, skin. And like I said, the more severe ones are the ones where the bacteria or the virus or the fungus is in the blood. And that is what we call as bacteremia, where the organism is in the entire blood. And that can develop into like something called sepsis, which is a severe organ dysfunction that can lead to mortality.
Okay, wow. Um, the next question we have is, how then do you diagnose infections in children after a bone marrow transplant?
So there are specific signs and symptoms that we look for that are sort of warning signs in terms of these children beginning to have infections, and fever is one of the cardamom signs.
Okay.
So any temperature more than 100.5 degree Fahrenheit in these children is taken very seriously, especially in the first few months of transplant. So any fever is presumed to be due to an infection, and usually a broad line of antimicrobials, one or two antibiotics, sometimes escalating antiviral therapy, antifungal therapy. They're all added upfront as we wait to figure out what exactly is the infection. I see. Once that is found out, then we can always tailor our therapy towards the infective agent. But the first few months requires addressing multiple organisms at the beginning till you find out what exactly is the causative organism. And that diagnosis of the causative organism, it requires various steps. If the infection is suspected to be in a blood or a body fluid, then you can actually culture it in the lab and grow the organism. Sometimes certain organisms like viruses are difficult to be cultured.
Right.
So we have ways to identify the DNA or the genetics of these organisms using different techniques like PCR. Again, they're all done in some specimen like blood or urine or nasal secretions or a biopsy sample. Then imaging, that is, using X-ray or CT scan or MRI to locate the infection. That's also an important part, especially when you have something like pneumonia, meningitis, or deeper infections in the abdomen. We always, compared to somebody who has not undergone a transplant, we start doing imaging tests pretty early on, just because it's very important to diagnose these early on.
Absolutely, absolutely. So what are the treatments available for infections that happen after the bone marrow transplant?
The treatment available is just like how you would treat any other infectious agent in a general population, except that it's usually very preemptive and aggressive. Yeah, bone marrow transplant patient. We have a set of antimicrobials directed against bacteria, against viruses and fungi. And as I said earlier, we tend to over-treat at the beginning, then under-treat.
Yeah.
Because you really want to catch these infections and control them early on. Injectable and oral antimicrobials are the major treatment for infections in bone marrow transplant. Just because the primary reason for these patients getting infections is that they don't have a strong immune system,
Right.
we sometimes tend to augment the immune system or the immune reaction by using a lot of cellular therapies. So, for example, you can engineer certain immune cells in our body called the lymphocytes in a lab to attack a particular virus.
Right.
They're called cytotoxic T lymphocytes. So you can generate them in the lab and give it to the patient.
Right.
So that immunity itself works against these viruses. Yeah. So that's above the antimicrobials. Because with antimicrobials, you run into things like resistance and, lack of response. Whereas the immune system is obviously a very potent way to address these microorganisms.
Right. Wow. That is, I mean, you think of so many different variables and you got to go down and shift them. So given all of these different, variables to consider, are there any ways that someone can prevent infections after having the transplant?
So infection prevention is the most important focus that we put on for parents and caregivers after bone marrow transplant.
Okay.
Because especially in the lower middle income countries, the major cause of mortality after transplant is infection. So it starts with very basic steps in terms of hand hygiene. Hand hygiene is very, very important. So, actually, the COVID taught us much more about hand hygiene than taught to you before. So, hygiene, caregivers, child, before eating, after they come into contact with any body secretions, hand hygiene in terms of how long you wash your hands, with what you wash your hands, especially when they have devices in the body. So, children after transplant sometimes have these central venous catheters, which are these lines that go into one of the major blood vessels in their body for easy accessibility for injections, to draw samples, for blood tests and all. So when you have a central venous catheter, we train the caregiver and a child old enough to understand in terms of how to keep that area clean and how to handle it. Then always there's a lot of focus on skin hygiene. Yeah. So in terms of taking bath and especially keeping the genital area, where you actually harbor a lot of bacteria anyway. So there's a lot of focus on how to keep skin hygiene, specifically in focus areas like genital areas, underarms, nasal cavities, etc.
Absolutely.
Then we tell them in general to avoid crowded spaces. If you know somebody is ill, don't go.
Right.
Yeah. And there are very focused areas also where, there are these vaccinations against chickenpox, measles, mumps. So these are called live vaccines. So there's actually a sort of a harmless virus that's injected into the body and you expect the immunity to happen against.
Absolutely.
But in children who have undergone a transplant, even that inactivated virus can sometimes cause infections.
That makes sense.
Yeah. So if they have a sibling and the sibling is due to get a live vaccine, we tell them to keep them away from the sibling. So whoever is getting the live vaccine, stay away for so many days.
Right.
Make sure that their entire virus is washed off from their body and then come and be in contact with the child one.
No, that makes perfect sense. Yeah. I'm thinking about my kids who didn't have chickenpox. Yeah. But I definitely did growing up. So final question we have is, what should someone do when they suspect an infection in their child after having the transplant?
So, most transplant centers have like a 911 mechanism by which the patient can immediately get in touch with the transplant team.
Okay.
So, and the shortest trigger to call that is actually a suspicion of infection, specifically in terms of fever.
Right.
So any fever, we tell them to call. And sometimes, especially in my setting where we work with a lot of patients from lower socioeconomic status, their level of understanding, education may not be that good. We actually tell them, if you have a fever, don't wait. Just start coming to the hospital. Then you can call us on the way and say that you're coming.
Got it.
Just because assessment of a child with fever, especially in the first few months of transplant, is extremely important. And administering that first dose of antibiotic before the infection gets to a point where you can control it back. So it's called the golden hour. So it's very important that the child comes to the treating center immediately and gets that first shot of antibiotic. And then we can figure out what is the infection, how sick is the child, should we admit, should we send them back? So that's the most important part. If an infection is suspected in the form of a fever, immediately bring them back. Then we usually educate the caregivers in terms of certain specific symptoms like breathing difficulty, a bad cough, a loose stool that doesn't stop, repeated vomiting, and then bad headache, in terms of meningitis and things like that. So, or any sort of skin infection where you see a spot of redness and it keeps getting bigger. So, call immediately. And if you are in a position where coming to the care center takes time, start from home already and then inform us on the way that you're coming.
Okay. Thank you for this insightful information. It's very thorough and comprehensive, so I really do appreciate your time.
Thank you.